Welcome to Mom Care Month 1, Mother's Recovery and Health. Congratulations on the birth of your child. Whether this is your first or fourth child, we know this is an important time. As registered dietitians and moms, we are here to support you. Once you arrive home with your new bundle of joy, recovery and caring for your baby will be the focus of your life. Recovery takes time, and having the appropriate nutrition and support can make all the difference in how you feel. This module is going to focus on your recovery and healing. This module will address the following topics and questions. How many calories should I be eating every day? What should be on my plate for each meal? A closer look at key nutrients to consume during this month, and a brief overview on sleep and fatigue. For more information about your baby's first month of life, refer to Baby Care Month 1. During those first few weeks postnatal, your focus and all of your energy is on how your baby eats, poops, and sleeps. You may even track and log these things each day. But what about you? Have you eaten? Have you slept? You've just spent hours, possibly days, in labor. You spent the last 9 months growing that tiny little baby you're now caring for. While our bodies are miraculous and designed to do this, it can still take a toll on us. Our health and well-being are just as important as our babies. During your first month postpartum, your body's recovering from delivery, adapting to hormonal and physical changes. Sleep deprivation may begin or even continue, all while the family dynamic and responsibilities are changing. Consuming enough nutrient-dense foods, drinking plenty of fluids, and getting enough rest are all important pieces to your recovery plan. Keep in mind, pregnancy, postpartum recovery, and lactation have the highest nutritional demand when compared to any other stage of life. How many calories should I be eating every day? Let's first dive into your nutritional needs. If you like counting calories, aim for 1,800 to 2,200 calories per day to help give your body the energy it needs. If you are exclusively nursing, your calorie needs will increase beyond this by approximately 500 calories more per day. This equates to 2,200 to 2,700 calories per day. Adequate caloric intake is important to support the production of your milk supply. Keep in mind, these calorie needs can vary based on your age, height, and activity levels. If you are looking for a calorie goal range based on your specific needs, sign up with one of our experienced NutriVantage dietitians who can tailor nutrition recommendations for you. If calorie counting is not for you, that's okay. Instead, focus on the plate method. Aim to make at least half of your plate vegetables, a fourth protein from plant or animal sources, and the final fourth of your plate whole food carbohydrates. This method allows you to focus more on the types of foods you are consuming to meet nutritional needs rather than your caloric intake. This approach is highly recommended because it helps keep not just calories but macronutrients balanced at mealtimes. When thinking through the plate method, it is important that protein, fat, and carbohydrates come from nutrient-dense whole food sources. Let's take a closer look at the importance of each food category and why we should include them in our diets. What should be on my plate for each meal? Let's start with the first half of your plate being made up of fruits and vegetables. The World Health Organization recommends aiming for at least 5 servings per day to help the prevention of chronic diseases such as heart disease, cancer, diabetes, and obesity, as well as for the prevention and alleviation of several micronutrient deficiencies. But some research studies have found that consuming 5 to 9 servings of fruits and vegetables is simply not enough. When we look at the dietary guidelines, recommended servings can range from 4 to 13 based on age, gender, and activity level. We can see that consuming adequate amounts of this food group is important for our long-term health. Looking at the postpartum period specifically, it's important to remember that you just spent the last 9 months growing your son or daughter, and during this time, your nutrient requirements for vitamins and minerals increased. Some of these nutrients include, but are not exclusive to, vitamin A, C, D, E, B, calcium, magnesium, selenium, iron, and zinc. These nutrients helped your baby grow and develop in the womb. After birth, there may be a need to replenish several of these nutrients. Fruits and vegetables are rich sources of these nutrients and other antioxidants, so reaching for a wide variety of all different colored veggies and fruit will enhance and support your postpartum recovery. We'll dive deeper into the specifics of some of these nutrients later in this discussion, as well as in more detail in later modules. Also check out the handout, Tips on Adding More Fruits and Veggies to Your Day, for easy ways to increase your intake. Let's look at the other half of your plate and break it down into two categories, protein and carbohydrates. The first remaining fourth of your plate is protein. Protein is found in every living cell and is considered the building blocks of life. When pregnant, protein is important for the growth and development of your baby. Once the baby is born, protein is an important fuel source for breast milk production. Consuming adequate amounts of this nutrient will help with production of breast milk and help preserve your lean muscle tissue. Research suggests an approximate increase of 20 grams of protein per day for exclusively and partially breastfeeding mothers. This could equate to 1 serving of protein-rich food per day, such as 3 ounces of tuna, 3 ounces of cooked turkey or chicken, or a half cup of cottage cheese. Reach for heart-healthy protein options, such as 90% lean, grass-fed beef, pork loin, chicken breast, tofu, eggs, legumes, and soy. Keep in mind that any cut of meat containing the word loin is going to be one of your leanest cuts. If you are consuming protein-rich foods at each meal and at most snacks, you should have no issue meeting your protein needs. The second fourth of your plate would be made up of carbohydrates. Carbohydrates provide energy to your brain and cells. They can be found in dairy products, fruit, starchy vegetables like potatoes and winter squash, cereals, and grains. Choosing whole food carbohydrates can provide lasting energy and satiety because of their nutrient and fiber content. As a new mom, you want to make your meals count so you don't have to run to the kitchen every hour due to hunger. Whole food carbohydrate sources that include those starchy vegetables, fruit, legumes, dairy, and whole grains can help with this. Also mentioned, part of the plate method is dietary fat. Fat is essential to your recovery. As we've mentioned above, some nutrient depletion may occur after the birth of your child, and adequate fat consumption can help with this absorption of those vitamins, especially those that rely on fat for absorption. These vitamins are important for your health as well as the breastfed infants and include vitamins A, D, E, and K. It's important to note that after giving birth, your body goes through a rapid change in hormones. Adequate amounts of fat can help to balance these hormones. When it comes to your child's wellness, the fatty acid known as DHA has been shown to support your infant's eye and brain development. Fat also plays an important role in satiety and balancing blood sugars. Consuming healthy fats can help keep you feeling fuller longer in between meals. Consider incorporating a heart-healthy fat at each meal. This could include, but is not limited to, tuna, mackerel, salmon, avocados, nuts, seeds, olives or olive oil, and avocado oil. Beyond the plate sits a glass of water. Hydration is also an important component to your overall health and recovery. Research has shown that adequate hydration may support regular bowel movements, memory, prevention of headaches, improved skin elasticity, and reduction in urinary tract infections and hypertension. Keep in mind, there's no evidence to support the fact that increasing fluid intake will increase milk production, but fluid needs do increase while nursing. The current recommended daily intake if you are not nursing would be approximately 12 8-ounce glasses of water, and if you are nursing, it would be approximately 15 8-ounce glasses. If you do not want to track your water intake, consume water before grabbing other fluids, especially when you're thirsty. You can also check in your urine color. If it's bright yellow, consider drinking more water, and if it's pale yellow, you're consuming an adequate amount of fluids for your body. If you're not a huge fan of water, finding low-calorie and low-sugar alternatives can be an option. Also consider adding fruit to give your water some flavor. When it comes to nutrients your body requires postnatal, there are a few we are going to focus on today. But first, let's address the question, should I continue to take my prenatal vitamin? The simple answer is yes. You want to continue taking a supplement to help support the nutrients you're consuming through your diet. Nutrient-rich foods should always come first before supplements, but sometimes a vitamin can help ensure you are getting adequate nutrients when nutrient demands are high after pregnancy and while nursing. Once your prenatal is finished, it is recommended that you consider swapping to a postnatal supplement, since they are formulated to provide nutrients that are most important to your body postpartum. Now that we've discussed a postnatal supplement, let's look at some specific nutrients of importance. Now let's talk nutrients. First, let's discuss choline. This nutrient is not discussed very often, but is an important one. Choline has been shown to play a significant role in infant brain and eye development and helps improve mother's mood and memory. There's a high demand for these nutrients during and after pregnancy, which exceeds the body's supply in stores, which often leads to depletion. We discussed DHA in detail earlier in this module, but I want to mention it again here because it's been found that DHA and choline work synergistically to provide brain and eye support to infants. Insufficient intakes of both nutrients have been shown to impact maternal and infant health in a negative way. According to the National Institute of Health, adequate intakes of choline are 400 to 425 milligrams a day for a non-pregnant female. During lactation, this nutrient needs increase to 550 milligrams a day. The top two sources of this nutrient are liver at 356 milligrams and eggs at 147 milligrams. Not many of us consume liver, but if you like it and can incorporate it, it's a great source of not just choline, but vitamin B12 and iron, which we'll discuss the importance of a little later. Eggs have been in and out of the spotlight as being a healthy and not so healthy food, but at this time in your life, we encourage regular consumption of eggs in your diet so you can get a whole food form of choline. A fun way to incorporate them is through quiches and egg scrambles. Check out the breakfast recipe you received with this module for a delicious way to prepare eggs for breakfast. Other mentionable whole food sources include beef, to which comes in at 117 milligrams, roasted soybeans at 107 milligrams, and both 3 ounces of chicken and ground beef have 72 milligrams. Now let's discuss iron, which is the blood-building nutrient that is especially important during recovery. The recommended dietary intake of iron is 18 milligrams for a female who is not pregnant. During pregnancy, the recommended intake increases to 27 milligrams, and once your child is born, the recommendation drops down to 9 milligrams if you're breastfeeding. The recommendation is decreased because iron is lost through breast milk at about half of what is lost during menstruation. But this does not take into consideration low stores prior to pregnancy, depletion from pregnancy, anemia, lochia, which is vaginal discharge after birth that includes blood, and blood loss during birth. Fatigue, headaches, dizziness, leg cramps, cold hands and feet, thyroid dysfunction, and depression are all symptoms that can point towards iron deficiency. Postpartum depression is a common concern for mothers after giving birth, and research has shown that you are 2.5 times more likely to have postpartum depression if you are iron deficient. It's recommended you ask your physician to screen for low iron at the first postpartum visit, so if you are deficient, you're aware and can take action to increase your consumption. Good sources of iron and B12 include clams, oysters, beef liver, chicken liver, ground beef, and ground turkey. A brief overview of sleep and fatigue. The final topic on the list for today is sleep. You have just spent hours using your energy to bring your child into the world. Prior to this, you may have lost sleep due to discomfort of your growing womb, the movement of your baby at night, or the need to use the restroom every hour. Now that your child is home with you, their sleep cycles are short and they often need fed every 3 to 4 hours, especially in those first few weeks of life. During this time, our brain shifts to be more alert so that when we listen, we can hear our baby while we're sleeping. Between our brain's response to our child and hormonal shifts after birth, our sleep patterns and quality of sleep are greatly altered. Specifically, the low levels of the reproductive hormone estrogen can lead to sleep disturbances. With time, your hormone levels will balance and return to normal, but if you notice that your sleep quality continues to dwindle and you do not feel refreshed after a short nap, it may be time to seek help or mention this to your physician. Keep in mind, it's normal to be tired. Your life has changed and you are now caring for another human being, plus dealing with hormonal shifts, learning to care for baby, discomfort from birth, and figuring out your new normal. But you should still feel refreshed and your mood should improve after sleeping. If this is not occurring, you may also want to be screened for postpartum depression. Research has shown many links between decreased quality of sleep and a link to postpartum depression. Another link to fatigue and even postpartum depression is a lack of specific nutrients like iron, B12, and vitamin D, and magnesium. We suggest having a lab done to test for nutrient deficiencies if you feel like this is an issue you're facing. We will discuss more about postpartum depression in Mom Care Month 2. Keep in mind, the general recommendation for sleep is 7 to 9 hours per night. While this may be virtually impossible during the first year of your child's life, it is still important that you get as much sleep as possible, even if that's in cut up chunks of time. To help improve your sleep, consider the following tips. Sleep when baby does, especially in the first month. Avoid blue light or 1 or more hours before trying to sleep. Accept help when it is offered. Allow others to care for your baby so you can rest. Avoid activity close to bedtime. If you can't sleep, try to avoid becoming anxious. Get up and instead distract yourself